Step 69, uterus factors. Each high-grade blastocyst embryo has got its own potential to implant and become baby. So some embryos may have a 100% chance of becoming baby, provided the conditions for implantation and placentation and pregnancy is right. So some embryos may have zero chance of potential. Only way of finding out is creating most optimal condition for implantation from uterus point of view in allowing this embryo to implant and become baby. If uterus is entirely healthy, so you give a full potential for that embryo to implant and become baby. If uterus is unhealthy, then embryo may not attain its full potential. It may not be able to implant. So this chance of implantation for this embryo, even if it's high grade and has a full potential, is 0 to 100, depending on severity of the condition uterus has. There are 10 uterine conditions which can reduce chance of implantation for the embryos. So these are adenomyosis, endometriosis, hydrosalpinx, pelvic infection, uterine fibroids, uterine polyps, uterine septum, intrauterine adhesions, endometrial fluid, and thin uterine lining. Depending on how severe this condition for each individual person, the chance of implantation can range from 0 to 100% for each given embryo. In order to improve the chance of implantation, you should identify these conditions before IVF or during IVF treatment cycle and freeze the embryos, then treat these conditions medically or surgically, then do embryo transfer. That will give each embryo best and most optimal chance for implantation.